Okay, I've gathered all my supplies for today's assessment. I have my stethoscope, my pen light, my Rosenbaum chart, and my tongue depressor. Okay, you can come in, have a seat. Okay, so my name is Dallas, and I'm going to be performing a head-to-toe assessment with you. I've closed the door for privacy today, and I've already taken her vital signs. Her pulse was 60, her respiration rate was 16, her blood pressure was 120/80, her temperature was 98.6, and I couldn't take her O2 saturation because I don't have the probe for it. Can you rate your pain on a scale of 0 to 10 for me?
0.
Okay, so her pain's 0. Her height is 5'3", her weight's 122, and I've calculated her BMI is 21. Okay, so first, I'm going to start with just a general inspection. Overall, she looks clean and healthy. She looks like she has adequate hygiene. Her skin color is white. She's Caucasian with a slight tannish tint to it. Her height and size it correlates with her stated age that she gave me. Okay, so she's well nourished, well developed. She has upright posture, steady gait. I saw when she walked in. She has full mobility and good balance. So she has, from what I can tell, full range of motion. She has no deformities, no involuntary movements, and no mobility aids. Okay, she can speak, hear, comprehend, and follow simple instructions because she heard me come in, she answered my question, and followed a simple instruction. Can you tell me where you are today?
I'm at home.
What year is it?
2021.
And what's your first and last name?
Kristen Robertson.
Okay, so she's alert, oriented to person, place, and time. Okay, what's your native language?
English.
Okay, so her native language is English, so we don't need a translator today because we both speak the same language. So she has clear, she can speak clearly, it's clear articulation, and she has full voice quality. Okay, her mood is calm and cooperative. She is dressed appropriately for the assessment, and she came in dressed appropriately for the weather today. Okay, so first what I'm going to do is I'm going to start by palpating her head. I'm going to palpate the contour of her head. Her head's round, it's normocephalic. Do you feel any tenderness?
No.
There's no tenderness in her head. I feel no lumps and see no lesions. And I'm palpating her skull right now. So then I'm going to move on to her hair. So her hair is, it's thick, it's brown, it has a good smooth texture, it's shiny, it looks clean, and I don't see anything like any abnormalities with the hair either. Okay? So next I'm going to move on to her face. Her face is symmetric, the skin color is appropriate for her race, and it's evenly distributed across her face, and it matches the rest of her skin. So I don't see any lesions, any blemishes on her face. So first I'm going to feel for temperature on her face with the dorsal side of my hand. Okay, her face is warm. Do you feel any tenderness whenever I touched it? It's warm, it's moist. Okay, so now I'm going to feel your bony prominences of your face. Do you feel any tenderness whenever I touch them?
No.
Okay, no tenderness on the bony prominences, and she has, they're all symmetric and they're the appropriate size for her normocephalic head. Okay, so now I'm going to just inspect your facial features. They're symmetric, and I see no weakness in your facial features either. So now I'm going to palpate the TMJ. Can you open your mouth? Do you feel any tenderness?
No.
No tenderness with the TMJ, and no crepitus with that either. So that she has full range of motion of her TMJ. So now can you clench your teeth? Okay. Do you feel any tenderness?
No.
So I felt her masseter, so that's cranial nerve 5 when she clenched her teeth. Okay, can you smile for me? Can you frown? Can you puff out your cheeks? Can you raise your eyebrows? Clench your eyes shut? Okay, so that shows me that cranial nerve 7 is intact. So now I'm going to go ahead and palpate all of her pulses. So first is her temporal pulse. Okay, then I'm going to go to her carotid. I'm going to do one at a time. Then I'm going to move down to her brachial pulses. and then her radial. And then I'm going to go to her posterior tibialis, and then to her dorsal pedis. Okay, all pulses were equal and bilateral with 2 plus amplitude. Okay, now back to your face. Okay, let me make sure I did everything. Okay, first, well now I'm going to go ahead and palpate her lymph nodes as well. So first you have your pre-auricular, post-auricular, occipital, then you have submandibular, mandibular, submental, sublingual, tonsillar, anterior cervical chain, posterior cervical chain, supraclavicular, and can you shrug your shoulders, intraclavicular. Did you have any tenderness whenever I palpated your lymph nodes? No tenderness, and they were non-palpable. Okay, so now I'm going to move on to your eyes. So your eyes are symmetric. Your eyebrows are evenly distributed. The color of the eyebrows matches the color of your hair. Your eyelashes are also symmetric. They match the color of your hair. Your eyes, the position, blinking, and closure is all symmetric, and it looks like your eye color is brown on both sides, so that's symmetric as well. So now I'm going to actually look at your eyes, and I'm going to look at your sclera, and it's white. It appears to be white. And then I'm going to look at the conjunctiva, and it's pink and moist. And then the irises, they're brown and round. Okay, so now I'm going to look at the corneas. The corneas, they're clear and glassy with no fogginess, no lesions. I see no like abrasions in the cornea. The other one's also the same. No foreign bodies, that shouldn't be in there. You have any pain with your eyes? No pain. Okay, now I'm going to test the corneal light reflex. So I'm just going to shine light under your nose, and the corneal light reflex is symmetric on both sides of both eyeballs, so that shows me that that's intact. Now I'm going to test using the Rosenbaum chart. So I want you to hold this out 14 inches, and I want you to cover your right eye and read me the lowest line.
428739.
And then cover your other eye and hold it out.
428739.
And then read it with both eyes.
428739.
Okay. So that tested cranial nerve 2, and it showed me that she has 20/20 vision in both of her eyes. Okay, now I'm going to do your peripheral vision. So I want you to cover the same eye as me. And I want you to tell me whenever you see my hand.
Yep.
Other eye.
Yep.
Okay, so that also shows me that cranial nerve 2 is intact as well. Okay, so now I'm going to test cranial nerves 3, 4, and 6. And I want you to follow this pin, and I'm going to test her eye movement. Okay, so that showed me that cranial nerves 3, 4, and 6 are all intact as well. So now I'm going to test Perla, which is cranial nerve 3. And first I'm going to start by doing the accommodation. So I want you to look at the pin light and then look at the wall. Okay, so her accommodation was intact because her pupils dilated and contracted whenever they were supposed to. Now I'm going to do pupillary response and consensual reaction. So first in this eye I'm going to do pupillary response. And then I'm going to look in the other eye and do consensual response. Okay, and then I'm going to do the same on this eye. Pupillary response, capillary response. Okay? So pupils are equal and round and reactive to light accommodation, and that tested cranial nerve 3. Okay? And so now I'm going to move on to the ears. Okay. So the ears, they look like to be symmetric. They are evenly situated on each side of the head. They are appropriate size to their normal cephalic head. The color of the ears looks to be equal on both sides, and it's also appropriate for your race, and it matches the rest of your skin color. By just inspecting the external ear, I see no lesions, no foreign objects, no lumps or anything that shouldn't be there. Now I'm going to palpate the mastoid area. Do you feel any tenderness?
No.
No tenderness, no lumps, no abnormalities felt. Her ears are intact, she has no piercings. Okay, now I'm going to inspect with the pin light. I'm going to look in your internal ear to make sure there's no foreign objects or lesions visible. Okay, I see no foreign objects, lesions, or drainage from that ear. And then over here, I see no foreign objects, lesions, or drainage either. Okay, so lastly on the ears, I'm going to test her cranial nerve 8 by doing a whisper test. So can you close that ear for me? And repeat after me.
1, 2, 3, 4, 5, 6.
Okay, so cranial nerve 8 is intact. So next I'm going to move on to the nose. So her nose is symmetric to her face. It's midline. The skin color matches the rest of her body. I see no lumps, no abnormalities. The skin tone's even. So now I'm going to feel it. Palpate for tenderness. Do you feel any tenderness?
No.
No tenderness, no lumps. Now I'm going to get you to look up. I'm going to look in her nares. They're pink, they're moist. I see no foreign objects, no lesions, discharge, and her septum's also midline, so she has no deviated septum either. So now I'm going to get you to hold your one nostril and breathe out or in, and then do the same other. Okay, so she has good patency because she's able to breathe in and out while holding one nose. Okay, next is going to be your mouth. So by just observing your lips, they're pink, they're moist, they're symmetric. I see no lesions, no fissures in the corner of her mouth, no cracks in her mouth. So now can you open your mouth for me? So by her sticking out her tongue, I can see it's symmetric, it's pink, it's smooth. Her soft and hard palate are both intact and they're pink and moist. And then her floor of her mouth is also intact and it's pink and moist as well. So now I'm gonna look at her gums. Can you open your mouth? Her gums are pink. They are the same color as the rest of her mouth. Her teeth are white, they're straight, and it looks like she has 28 of them because she got her wisdom tooth taken out. Okay, and now I'm gonna look at your oropharynx. So your oropharynx is pink. It's got no lesions, discharge, foreign objects back there, no odor coming from it. So now I'm going to take my tongue depressor and I'm going to get you to say ah. Okay, so her uvula rises and falls as it should, and now I'm going to test her gag reflex. Okay, so that shows me that cranial nerves 9 and 10 are intact. Okay, can you stick out your tongue for me? Move it side to side, up and down, and side to side your mouth too. Okay, that showed me that cranial nerve 12 is intact. Okay, now I'm going to move on to her neck and shoulders. So her neck and shoulders appear to be symmetric, even skin tone. The color matches the rest of her body. I see no lesions, no abnormalities on it. I'm going to palpate it for tenderness. So let me know if you feel any tenderness whenever I palpate it.
No tenderness.
No tenderness, okay. No tenderness, I feel no lumps or anything that shouldn't be there. So now I'm going to palpate her trachea. Do you feel any tenderness there? No tenderness, her trachea is midline too. Now I'm going to palpate her thyroid. Can you swallow for me? Okay. Did you have any tenderness with that? No tenderness, no goiter, so her thyroid is not palpable, so that's good. Okay, can you swallow for me? Okay, so by her swallowing, that shows me that cranial nerve 5, 7, 9, 10, 11, 12 are all intact as well. Okay, so now I'm going to move on to her anterior chest. So just by observing, her anterior chest is symmetrical, her shoulders are symmetrical, her neck's symmetrical. Her anterior chest, I see no retraction, sign, or pulsations, and I see no heaves, lifts, or paradoxal movements or thrills in her chest. I see effortless breathing, so she's not struggling to breathe. I see no abnormalities. I see no lesions, lumps, bumps, anything. First, I'm going to palpate the bony prominences. First, I'm starting with the clavicle. Do you feel any pain? The sternum, and then the ribs, the anterior ribs. Okay, so she reports no pain there, and everything feels good. There's no abnormalities, no lumps or bumps on her clavicle, sternum, or ribs. Okay, so the first thing I'm going to listen to is your 8 lung sounds on the front. Okay, just breathe for me. Okay, I heard no adventitious sounds and it was full clarity. And before I move on, I'm going to get you to shrug your shoulders for me. Then it gets resistance. Okay, so that showed me that cranial nerve 11's intact too. So now I'm going to move on to your heart sounds. I'm going to listen to each point of your heart for 10 seconds, and I'm going to do it with the bell and the diaphragm. I'll do the diaphragm first. Okay, first is the aortic. And then pulmonic. And then Erb's point. And then tricuspid. And then mitral. Okay, now I'm going to do the same with the bell. Aortic. Pulmonic. Erb's point. Tricuspid. And then mitral. Okay, heart sounds were S1, S2, regular rate and rhythm. And I heard no gallops, no stridor, no murmurs, no abnormal heart sounds whenever I was listening to your heart. So now I'm going to palpate your apical pulse. Okay, apical pulse has a regular rate with 2 plus amplitude to it. Okay? So now I'm going to move on to your posterior chest. Okay, so your posterior chest, it looked just like by observing it, it looks symmetric. I see no abnormalities, no lumps, bumps, lesions, anything. I see no dimples, no curvature of the spine from like what I can see. So now I'm going to go in and I'm going to palpate the bony structures. So first I have the scapula. Do you feel any tenderness?
No.
And then the spinous process.
No.
And then your posterior ribs.
No.
Okay, so she felt no tenderness. All of those felt intact with no abnormalities to them. And just by me feeling the curvature of her spine, I didn't feel a curvature of a spine. By me feeling her spinous processes, I mean. Okay, so first I'm going to listen to her 10 lung sounds in the back. Just breathe for me. Okay, now I'm going to listen to the 7 lung sounds on the side, and I'm going to start on the right side since it has 4 lobes. on the posterior and the sides of lungs, I heard no adventitious sounds, and there was clear clarity. Okay. Now I'm gonna get you to go ahead and flex your neck for me, hyperextend it, move it side to side, and rotate it, and then turn left and right. And then can you raise your arms up for me to test her abduction and adduction? Okay. Now I'm going to move to the upper extremities. So just by looking at the arms, everything looks symmetric. Everything's evenly distributed. The skin color is appropriate for her race, and it matches the rest of her body. Okay, I'm going to feel the arms for temperature first. They feel warm and moist. Do you feel any tenderness whenever I touch them? Okay. Now I'm going to palpate them for edema. And I see no signs of edema whenever I'm palpating them. Okay, now can you do your fingers like this? Okay. And I see no clubbing because you can see the diamond shape in between her nails. That shows no clubbing. Can you hang your hands? Okay, I'm going to test for turgor first. So she has good skin elasticity and she has no tinting present. Now I'm just going to look at her fingernails. Her fingernails are clean, pink. They're clipped, so it shows that she has good hygiene. They're round, and I'm going to test for capillary refill. Okay, her capillary refill was less than 3 seconds, so that's intact. Okay, now can you rotate your arms for me? Can you bend your elbows, and can you move your wrists around? Okay, so she has active range of motion. Did you feel any tenderness? And with no tenderness. Now I'm going to come in and test her passive range of motion. Okay, so do you feel any tenderness? So her passive range of motion, she had full passive range of motion, full active range of motion, with no tenderness, no crepitus in either of those. Okay, so now I'm going to move on to her abdomen. Can you lay down for me?
Yes.
Okay, so just from looking at it, I see no pulsations, no peristalsis. And now I'm going to get down like eye level with it and try to look at it. It's flat. I see no pulsations, no scars, no lesions. Everything's symmetric on the stomach too. So the first thing I'm going to do is I'm going to listen to her bowel sounds each for 15 seconds. Okay, her bowel sounds were normoactive. So now I'm going to listen to the epigastric region of the abdominal aorta with the bell and listen for bruit. Okay, so I heard no bruit whenever I listened to the epigastric region. So now I'm going to go in and I'm going to palpate each quadrant. Do you feel any tenderness? No. There was no tenderness in each quadrant. There was no abnormal masses or lumps or bumps or anything. Now I'm going to palpate the umbilical region. You feel any tenderness there? No tenderness. There was no lumps or bumps there either. And she showed no signs of guarding, so that shows me there was no tenderness there. Okay, you can sit up. Okay, now I'm gonna move on to her legs. So her legs, they're symmetric, they're even, they have even skin tone, and the skin color is appropriate for the race. There's no scars, lesions, lumps, or bumps. I'm gonna go in and check for temperature. Okay, temperature is warm, moist. Do you have any tenderness whenever I touch your legs? No tenderness. I'm gonna go in and check for edema. Okay, there's no edema on the tibia. Okay, now I'm gonna go ahead and test all your muscle strength. So can you hold your arms like this for me? Can you pull toward yourself, push, and then do this? Okay, so all of her upper body strength was 5 out of 5 bilaterally, with her triceps, biceps, and every upper body muscle. So now I'm gonna come in and I'm gonna, so her legs, ankles, feet are all symmetric. I'm gonna come in, I'm gonna go ahead and test your muscle strength too. Push down, push up, pull to me, push, okay, push down, push up, okay. So her lower extremities, muscle strength was a 5 out of 5 too, equal and bilateral. Okay, now we're gonna go to the feet. Her feet, they're symmetric. They're clean. I see no abnormalities. Her toenails, she took 2 toenails off of me so I could test her capillary refill. Her toenails, they're round. They're all equal in size. It shows me that she has good hygiene. They're brittle. They're hard and good. Okay, so now I'm going to test your capillary refill. Okay, your capillary refill is less than 3 seconds in each foot, so that's good. Now I'm going to go ahead and look at the bottom of your feet and your heels, and I don't see any fissures or anything, or lesions on your feet, so that's good. So now I'm going to get you to stand up, and I want you to kick out your knees, rotate your ankles, and squat for me. Okay, so do you have any tenderness there?
No.
Okay, no tenderness. Should mean that her active range of motion in her leg is good. It's equal bilateral too. Okay, while you're up, I'm going to go ahead and get you to bend over, and so I can test for scoliosis and kyphosis. So I had already palpated her spine and felt no curvature of the spine. So that gives me a feeling that there's no scoliosis, and her hips are even, her shoulders are even, and then she has no signs of kyphosis either. Okay. Now can you lay down one more time, and I'm going to test your passive range of motion in your legs. Okay. And I'm going to do your other leg. Okay, did you feel any tenderness whenever I did that? No tenderness. So she has full active and passive range of motion in her lower extremities, and also full passive range of motion in her upper extremities with no tenderness or crepitus in either. Okay, I'm going to check my card and see if I missed anything. She had no sighing either whenever I checked her chest.